Welcome. I'm Lee Doherty Biddison.
And I'm Carolyn Kamsti-Fowler, and we're your co-hosts for the Johns Hopkins Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace well-being in healthcare, and we're excited to share what we're learning.
Thank you for joining us. Hello, and welcome to another episode in our podcast series. I'm Carolyn Kamsti-Fowler, and my guest today is Carolyn Carpenter, who is president of the National Capital Region for the Johns Hopkins Health System. In this role, Carolyn is responsible for the strategic growth and operational performance of all current and future Johns Hopkins medicine entities and initiatives within the National Capital Region, which encompasses Washington, D.C., and the adjacent counties in Maryland and Northern Virginia. I've been inspired by Carolyn's commitment to practicing and encouraging work-life integration and by her engaging and relational leadership style. And I hope you get to enjoy knowing Carolyn the way that I do. Carolyn, welcome.
Thank you. I'm really delighted to spend this time with you today.
Well, I'm thrilled that you're here, and we're going to break from our current pattern of me giving a long bio or a longer bio. And I'd like to invite you to share with us maybe some of the highlights or the ahas that you've gleaned from 30 years as a leader in the healthcare industry.
Absolutely. Well, I often start with reminding folks of how long I've been at this, and that's for a few reasons. Number one, you learn a lot over time. One of my favorite leaders actually said to me when we were talking about positions many years ago, she said, I like to hire people who've been in organizations long enough or in fields long enough that they have to clean up their own messes that they've made. So I think the longevity in the field for me, which is that I'm sitting here doing my calculations, technically 33 years of having the privilege, and that's how I see it, the privilege of working in healthcare and healthcare administration is core to how I come to leadership every day, because I've probably made many mistakes before that I have learned from, and as I have the opportunity to see what I think of as constant reinvention and constant learning as, in many ways, the foundation of how I work and lead. So I've been at this for more than 30 years. I've spent more than 90% of my time in academic medical center environments, the remaining in community, hospital, and healthcare environments. And that has very much influenced my passion for what I call bringing life-changing care to individuals and communities. And it's because I have seen the power of the intellect and the discovery and the multidisciplinary teamwork of the academic environment. And I've seen the power of the scale that allows for compassion and excellence and service in a community environment. And I have said this multiple times over the last 4 years. I've been at Hopkins 4 years. I have the best job because I get to spend my time working on what are those synergies across community care and academic medical center environments that can really distribute and grow life-changing care. So today I'm in the NCR. Before that, 3 years in Virginia Hospital and Health Systems. Before that, 20 years in an academic environment at Duke. And before that, 2 other academic environments as well. And probably the last thing I'll mention is when I was in college, I helped start a dance company. And I share that with you because I think in many ways, it was my initial set of leadership lessons around how do you take a passion that you have, and for me it was dancing, and create something that brings people together to move down a common path. In that case, it was both recreation and performance. And how do you understand developing functions and systems and processes? And now I will tell you, college kids are pretty unruly in a way that motivates people for a common purpose. And I didn't know that then, but I look back on that now and say that was really an incredible opportunity for me that started my leadership journey.
What a lovely story, and I can just hear your energy around it as you share it. And the picture that's coming to mind for me is almost this beautiful mosaic pathway, with all these different little pieces that have contributed to the path you've walked in leadership. So, as you think back over these 33 years, Carolyn, what are the most important influences, do you think, in your current leadership style?
Truly, the most important influences for me have been tremendous examples of leaders, which was luck. That is definitely the opportunity of having been in some extraordinary organizations and learning by watching, learning by being taught. I am a product of what I call an apprenticeship model of learning in healthcare administration, which is not as common today as it was then. That has given me a lot of food for thought, as both watching how people were extraordinary in making change, being literally at the elbow of people who were doing that, and then also being stretched and being given opportunities to do that. So extraordinary examples, I would say, is one category. And then the other is really the very talented people on the teams that I've been with. I really believe that the job of a leader is to listen to what their teammates are saying and what they want to get out of life. So, not just work, but what they want to get out of life, and find a way to link that purpose, that sense of purpose they have, to what you're doing in the organization and what you're doing as a broader team. And so when I think of some of my best leadership lessons, they are not always easy things that were said to me, but things that were said to me by teammates. I was just talking with one of our board chairs recently about how, when I reflect on some of the best lessons for me, I remember bumping my head against the wall and not making progress with the team. And two of my, at that time, formal leaders, they weren't even informal, and often it is the informal. I sat down with them and said, "Why is this not working?" And they looked at me and they said, "You need to not be there." And it was an issue that had great interest, and passion and importance to me, but the way I was working with the group and the role I had in the group was not allowing them to be successful. And so, first of all, we built the trust that they could say that, and I said thank you and left the group, and they did an incredible job. And so I watched the results do exactly what I had hoped from the beginning. But it goes back to, who are those influences? It is often those trusted teammates who put the mirror in front of you and say, look at how your behaviors and your statements and your approach are not supporting the successes for everyone in the room.
Right. So they care about you and your success enough to tell you the truth, even when the truth is sometimes hard to hear.
You got it. That's exactly right. And creating those environments where people will do that and can do that has been a focus for me in my career.
Wonderful. Well, you are known throughout our health system as someone who's a deeply relational leader. And you've begun to describe it, but can you tell me why this is so important to you? And I know you've said to me you absolutely prioritize relationships. Can you help us understand sort of the power of these relationships a little more?
Absolutely, absolutely. The way I view it is the connections we make with the members of our team teaches us how to best support them and set them up for success. And in those relationships and in those connections, you have the benefit of setting the different team members up for success, understanding what their strengths are, so you build across a team on the strengths, not on the weaknesses. And you allow the diversity of those strengths to really flourish. And for me, really great teams are about developing this trusting relationship with members who have those different skills and approaches, which requires One of my new favorite phrases of the last couple of years is generous listening. I heard a woman named Anna Leota describe that. But to do the generous listening that allows you to connect and understand those strengths so that you can help set those people up for success, that then allows the teams, because we all know, like empirically, we know teams do better work than individuals. Better, you could define 100 different ways, but teams do better work. So how do you create those teams? It's absolutely about understanding the individuals and then their strengths and then the path to setting them up for success and allowing the team to do that.
Now, this is so interesting because from one perspective, we could hear you describing something that's about organizational success, productivity, all those sort of quantifiable metrics that help us see that we're creating the outcomes or achieving the outcomes that we care about in healthcare. And then as I listen to you from the perspective of well-being leadership, I'm hearing you describe something that's about really creating a sense of belonging, that sense that I'm seen, I'm known, I'm respected, and I belong to this team. How how do you think about that interpretation that I'm offering you?
I really support that. And in particular, I often think about how do I interact with individuals that lets them know they are heard? Because I do believe belonging, the requisite for belonging is to be heard and seen. And more often than not, I can do a track to seen, but the heard are people being heard for their individual gifts, the sum total of what their life experiences are bringing to the situation or the problem or the environment. And I really believe that that is a sense of belonging when you are heard for the total of who you are at work, not just who you are as a worker.
Mhm. Well, and we know that that deep sense of belonging is something that is an important prerequisite for well-being. I mean, if we think about resiliency, knowing that you have support and connection, that someone has your back, and that you are safe and heard and included is a major factor in our well-being, and not just our well-being, but our sense of professional fulfillment.
Absolutely. I think of how well do we each understand our own sense of purpose, and how well, when we're in different environments, does that connect with others? And so, knowing our purpose and knowing what someone else's purpose is that helps create that milieu of belonging is critical in my mind to all the advancements that we can make, particularly, honestly, if it requires creativity. I have, one of the fun parts of healthcare is it's a bit of chaos every day. Something in our industry throws us for a loop. But the positive of that is it reinforces the demand for creative problem solving and thinking.
Which, of course, requires that psychological safety.
Yes, exactly.
Carolyn, we have a lot of listeners who are different levels of leadership, for they might be at frontline leadership right now, clinical frontline or non-clinical frontline, and then some may actually be running organizations, like you are. What would you say to them about how relational leadership supports individual well-being, collective well-being, and professional fulfillment within a healthcare organization?
That's a great question. What comes to mind first is relational leadership makes the shift from followers to participants. And, certainly earlier in my career, a lot of the leadership lessons and dialogue was around how do you create followership. And I've never really resonated with that. And for me, relational leadership has helped me because it isn't about followership, it's about participants. And I
Mhm.
love when we talk about employee engagement because that's what it is. It's engagement that is at any level, in any role in an organization. That is what we need to aspire to. And so relational leadership has helped me with that concept of, well, people want, team members want folks in senior roles to be committed to developing them and having experience and caring about them and maybe even lucky enough to have some wisdom that in specific roles that is needed. What relational leadership really does is it says what it's about is the participation and the contribution of everyone matters at different points and in different ways with different problems.
Wow. So inspiring. But let's get a little practical here. Uh, Given the complexity and the pace and the level of change in today's healthcare organizations, we can so easily become task focused and just transactional. So, how do you incorporate these relational touch points throughout the craziness and unpredictability of every day?
Well, I think there are points that we have to be intentional with our teams. And, one very simple and maybe rudimentary example is when we come together in the National Capital Region as a leadership team, I strive to always have a moment where we share. It may be something, very mundane. It may be something very personal and touching, but team time, as I call it, because I like alliteration, is a part of our agenda every time. And often it is a question. And if it's a deep question, I give it to people in advance. If it's, just a what's your favorite movie question, I don't give that to people in advance. But to take a moment to be a person on a team does require intentional tactics sometimes. So that's a very specific, I think, just tactic that we use in everyday life. I think the other tactic that I've learned along the way that is so important is when we meet with people and we meet with our team members for all different reasons. And it is an environment where it allows for dialogue. So it's not 50 people, it's 2 or 3. Always begin the conversation with that person as a person, even if it's just, how was your weekend? Or isn't this, a challenging time because of this or that? How is your dog? How is your son? How is, the initial interaction that you have with your team members matters that it be as a person, not again, just as a worker or employee. And I strive to do that all the time when I meet with people. And I even strive, though I'm not as good as I used to be, to do it on email because email I think is a little bit aggravating. I'll use that word because it's a deluge. But I try to not say when I write a note to someone, very first, will you do blank? I try to say, I hope you're well, or I hope you're having a good day, or it was good to see you recently. And honestly, those are throwaway words, but what they are intended to communicate is I'm thinking about you first and then the task at hand.
Right. So you're checking in with them essentially in a spirit of curiosity, and that's establishing then that personal connection, which is your conduit for getting anything else done.
Well said.
Well, I mean, you put the words into my mouth. I just summarized. All right. So, I mean, I hear the passion in your voice about this. I obviously you're very skilled at it. But if you were talking to leaders who who feel uncomfortable with this more authentic or relational leadership style, what suggestions would you offer to them?
My initial thought with that question is to reinforce that the job of a leader is to listen. And therefore, if you're uncomfortable with it, come to the table with your questions prepared. Come to the table with that curiosity that you just mentioned. Come to the table with that sense of, I'm here to hear. I am not here to tell. And that will shift everything in a direction that sometimes gets unwieldy. Rabbit holes certainly exist, but will really set you up for success in understanding where people are in the process that you're trying to engage in.
Mm. Yes, I think you and I have had conversations before, and I know that you've heard me sort of almost obsessing about the importance of listening and building listening cultures in organizations to support well-being. Yeah. So, Carolyn, before we started recording this podcast, we had been talking a little bit about an assessment that I did at Hopkins when I first came into this role that you were part of. And I had shared with you that the thing that was so fascinating to me was that when I asked leaders how they thought leaders in organizations influence well-being, with very few exceptions, what I heard from them was, well, you have to role model your own well-being practices. And while I love the idea of somebody modeling well-being practices, including maybe having some balance in their life, it was fascinating to me that they didn't truly understand how, because of this position that they're in and this privilege that you said you have of being a leader, with that comes the ability to so positively organize or so positively influence organizational culture and well-being. So you've been very vocal about the importance of well-being and work-life integration and relationships. After that long-winded question,
Mhm.
what would you say about how leaders truly influence well-being at the organizational level through the work they do each day?
I think leaders influence and create environments by truly understanding this concept of excellence and progress to the results we aspire and plan for requires people bringing their best selves to these problems. We, I believe, generally recognize that these are complex situations and problems. I believe we generally recognize that this is a human industry, which means there's a lot of emotional content that is part of our environment. But I'm not sure we recognize often enough what it means to be bringing a best self to the table, because as often as it is a skill set that we're looking at in our work environments, as often as it is that we are assessing that skill set, we also need to be assessing, are people okay outside of work? Are they here with energy? Are they here with positivity? Are they here with the brain space came to mind, but it's even more than that. It's a wellness enough to actually hear each other. And those assessments of what's going on are a constant process that we should be having with our teams, a constant testing of what will help them, and learning what works in that regard. And knowing that it is not the same for each person. And as we learn what those things are, continue to push and influence. And I'd love to say role model, but I'll be honest with you, more often than not, I tell my team members where I failed and don't do what I do. and let me support them and let me tell them the not well-being implications of doing what I do sometimes. And I can recall one of my most influential mentors, and people on this podcast will likely know him, and that is Kevin Sowers. When I was a baby administrator, and I had the privilege to work with him, he would, with some regularity, call me and say, "Go home." And it was generally after 7:30 or 8 o'clock at night, and he was very clear on my pathology of working too much, and he was my boss. And he would, on occasion, pick up the phone and say, "Go home." And that taught me a lot. And generally, he was calling me either on the way home or he was home. And so there was some role modeling there, but it was the intervention on the individual level of understanding and assessing what was impacting wellness for me. It wasn't a complex issue, but understanding that and then stepping in and doing that each and every time, because I think we owe that to our team members when we ask them to be accountable for results.
Right. And I mean, for him, giving you permission to
Mhm.
disconnect from work and to not feel guilty or less than because you're doing it.
Mhm.
You
And
know,
you
that's
pass that on, right? I do that now. I walk in people's offices and say, "Go home. Go home. Let me stand over you. I'm not always successful, but let me stand over you till you pack your stuff up."
yeah. Or sometimes I just go for a walk while we have this meeting.
Yes, yes, yes. Or have you put that day on your calendar? One day a quarter. I was talking with one of my teammates recently and said, "You need to put one day a quarter that is unscheduled. That's your day. Is it on your calendar yet? Have you picked that day? Pick that day."
Oh, that's wonderful. Well, there are so many other things that we could discuss in our time together, but I think I'm going to just offer you an opportunity to tell our listeners whatever else you would like to tell them about your journey, about relational leadership, and about well being.
Well, as usual, two things come to mind, which is a little bit of my brain space issue. One thing I'd like to share is the intrinsic reward that comes from creating the conditions where your team members produce extraordinary results is just phenomenal. And I would love to be the billboard for, you can only know how good this feels when you do this. So that's one message. The other message that maybe simplifies that a bit is, I'm a gift giver, particularly in my personal life. I'm one of those folks that starts the Christmas gift list in July. I give gifts whenever I can. And I firmly believe that the, the point of relational leadership is gift giving.
Mhm.
It's the gifts that you give people by giving them the environment. It's the gifts that you give people by hearing them. It's the gift that you give people by giving them an opportunity that they may not have seen for themselves, that they then sail and just have incredible positive impact on others and patients and reduce the suffering that we spend every day. So the billboard of be a gift giver in this way is one thing that came to mind. The other thing that came to mind is, at least for me, I go in and out of environments at Hopkins right now that are struggling for all different reasons. And I do believe that there are moments in an organization where we need to be reminded of something that I have on my wall in one of my offices. And it says, you can always do the unthinkable. It just takes time. And a mentor of mine said that to me. And I want to remind people that it's truly possible if you use that time to develop the relationships you have with your team members.
And you You have described so eloquently there's not only that it's a gift, but it's a gift that keeps on giving, and that you described it as giving a gift to the people that you lead or the people you work with. And yet I know that you've also said to me that leading in this way also yields so many gifts for us as leaders, that with everything that
Yes.
we learn and yeah.
Yeah, that's what I meant by that intrinsic reward. It can fuel you, particularly now when things may be difficult or you may be tired or there may be some challenges that are hard to see the horizon. Those gifts absolutely give back to your own sense of impact in a way that can be very energizing and reinforcing and positive to help resilience of you as a leader as well.
Mhm. Carolyn, it's been absolutely delightful to have you here with us and for the gift of your presence and all of your insights. And I hope that our listeners have enjoyed getting to know you and your leadership philosophy as much as I have. Thank you so much for being here.
Thank you.
So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email us at owb@jhmi.edu.